Yeah, so in my house, we have a whole house filtration system. So the whole house is being reverse osmosed. And so all the water that's coming in is coming in with reverse osmosis. If you don't have that capacity, then doing shower filters can be great too. And you have to make sure you replace them on a regular basis. We also have a under the sink filter that remineralizes the water as well. We had some really bad fires in my area about 3.5 years ago. And when they tested the water, it had lots of terrible things in there. We already knew this already, and we wanted to do it. We'd only been living in the house in 6 months for 6 months, and that was a very good motivation to say, you know what, let's just go all out here. So we have the full house, and then we have underneath the sink. 'Cause that's how we're purifying our water at my house.
And what brand is that for the whole house?
I think it's called Springwell, I believe, or something like that. There's a lot of different companies out there. We like this one because it was a full RO. It could take a whole house, and it wasn't. There's a lot of fancier ones out there now that remineralize or even auctionize the water or auctionate the water as well, which I don't think is necessary overall. I mean, I think it's fancy and fun, sure, but the prices get very very high very quickly for people. So we felt this one. This one we have to get. We get the filters, all the carbon filters changed on a yearly basis, and we're good to go. The water tastes good. Whenever my kids, drink water outside of my house, they always tell me how terrible it tastes compared to where we are in our home.
How do you feel about hydrogen water for drinking and structuring water?
Good questions. So I was pretty skeptical, and I have to say I'm not entirely not unskeptical or whatever the word is about hydrogen water still, but I've had mixed experiences with it overall. I know what the research is supposed to show me that it's really what it can be is sort of a detox or antioxidant kind of deal. I don't know exactly how that works, but I have found in people that have more inflammatory load, they tend to do relatively well with hydrogen water. I think it's not something you should be drinking all the time. I think it could be taken more periodically. I don't use it a lot personally. I don't have a hydrogen water maker here at my house, but I think it can be used periodically, especially under more stress. And so it's one of the only other molecules that I know supposedly that redoxes like methylene blue does, interestingly enough, where it has the capacity to help you make energy and also has the capacity to help you detox as well. So I think there's something to it. And I do have some of my patients that do swear by it, that use it on a regular basis. I think the main thing is not is realizing as well that it's not always necessary to use it as an antioxidant. We don't. I think that the issue we come into a lot with supplementation, with these kinds of things, is that antioxidants aren't always something you want to just pound and pound and pound and pound, right? We want to be having a balance of things that are going to stress our system. And if you have too many things that are like an antioxidant around exercise, you're not going to see the benefits of exercise. So you shouldn't be drinking hydrogen water when you're strength training or when you're endurance training. Like these are not things that are going to help your exercise, at least with the performance aspects of things after you exercise. Like you want the hormetic stress of exercise to see the benefit. And so I think hydrogen in those cases is probably not a good idea. But if you're on an airplane and you want to have some hydrogen water, sure. If you're under a lot more stress, sure, you can do some hydrogen water, that capacity. When it comes to structured water, this is interesting. I think that my general sense here is that water that's mineralized in general is better than water that's not mineralized. Water that's structured is probably better than water that's not structured in general. But how you structure it and the way it's structured, there's so many variations in this right now. I mean, structured water, the best is what's coming out of the ground, right? Because what it's doing there is it's taking minerals from the rock. It's having the sort of vorticial flow that's happening because of being in streams and in that kind of setting. So I don't get crazy about it, is what it comes down to. I think if you want to vortex your water, you want to structure it, fine. If it makes you feel better, great. But most people aren't going to go there for what it comes down to. So if I can get them to mineralize their water, if I can get them to drink filtered water, like that's kind of where I mostly focus my time.
And when it comes to minerals that you're adding back in, what's a good brand?
So I use like some sea minerals. I have a couple different, brands that I use. The Element Company is okay. Overall, um, they have pretty good variety of the minerals. But I try to do it where if you're going to drink mineral water, try to get it from the source if you can. So like mineralized water, so water that's coming from the ground, mineralized is typically better. So your what's it called? Some of the brands that I use, the Gerolsteiner is one of them that I've used over the years. That's a good one. The Pellegrinos are pretty good. Those are remineralized, but they do have some natural minerals in them as well. And some sea salt minerals, there's a lot of companies that make them. You can get some of those pretty easily. So I'll have people use those. But in general, I really try to get people to think about not only minerals in their water, but minerals in their food and getting good sources of minerals in their diet as well. So, but but in general, I will also use some mineral supplementation in people as well, especially if they're very low on the mineral content of what they're doing on a day-to-day basis. And that could be from the companies that I mentioned. I use a lot of, they used to be called Claire. Now they're called something else. I think like SFI Health or something like that. It's another brand that of supplements that I've used for many years that I like. So those are some ideas.
I think you mentioned Pellegrino. So you're a fan of the carbonated water as well?
So carbonation versus non-carbonation is another big question for people. I think I'm okay with carbonation for most people. However, I think you should vary it up. I don't think you should have just carbonated water on a daily basis. For me, I know if I drink carbonated water, I'm going to be peeing every hour because the carbonation itself has some sort of caustic effect on the bladder wall in some people, and I'm one of those people, and I'll be peeing a lot more than I would otherwise. So if you don't have that effect, I think you can drink it more often. There's some question as to whether you can be leaching some minerals from your bone using carbonation over long periods of time. There really haven't been any great studies that I've seen on that. But I think what I care about is people are drinking water in general. I think that if you're drinking carbonated water, that's what's going to make you drink, then drink it. If you're drinking still water and that's what's going to make you drink, then drink it. Because most people are dehydrated on a regular basis. They're not getting enough water on a regular basis. And it's a big issue, right? And so I don't like people having a lot of juice and a lot of soda, of course, and like things like that are not as hydrating and also have calories and other kinds of things that aren't very good for us. My kids, I don't think have had like soda twice in their life, I think. But in general, hydration is really important. And if it's going to be carbonated or non-carbonated, I'm okay with it if you're going to get enough in on a daily basis. But if I have a preference, it's going to be more still water than carbonated because I do feel like carbonated water is not as hydrating in general. People tend to urinate more after they drink it compared to still.
All right. And as somebody who is a fan of hydration, you're prioritizing it. How does somebody begin to figure out how much to drink in a day? Can they just rely on thirst, or do you like to go by a certain calculation?
Yeah, there's a good calculation. I don't have the numbers exactly on the top of my head. I think it's like 2.7 liters a day for women and 3.2 for men, but don't quote me exactly on that. Part of it depends on body weight. A lot of it depends on exercise and how much you're exercising. And so I use those as general calculations for people, depending on what their body weight is, what their exercise amount is overall. And then from there, you asked about thirst. Thirst is not a very good source of our needs for hydration overall, especially as we get older. As we get older, our thirst receptors go down, and our thirst receptor capacity is also interesting because it's one of our last signs of dehydration, actually, is thirst. Not one of the first. Some of the ones you'll get before that: headaches, muscle aches, cognition issues, fatigue. These are all happening from hydration, oftentimes, actually. There's a book that my father made me read when I was maybe 12 years old. And it's called Your Body's Many Cries for Water. And it goes across all these issues as to why water is so important. Water is the main solution that carries our red blood cells, that carries the liquid of our bloodstream is made up of mostly water. We have water in our bloodstream, but about 60% of that water is actually in our cells and around our cells. So our body's about 60 to 70% water. I think it's about 60% water in total. And only about 20% of that water, if I'm not mistaken, is actually in our vascular system. The rest of that water, about 40% of it, is in our cells themselves, in our interstitial area. And so what happens is that people are drinking like caffeine or alcohol and other diuretics, things that are making us urinate. Like your urine doesn't look yellow because you're leaching out water from your cellular system and your interstitial system. So it may look like you're not dehydrated, but you are because you're taking all this water out of the system that didn't want to come out, right? Oftentimes we think of dehydration being yellow urine, yellow pee. But if you're drinking diuretics or having diuretics like your caffeines, your alcohols, energy drinks, or you're taking medications that are diuretics, you're not going to see that yellow urine. So yellow urine is not a great sign for everybody, especially if you're on those kinds of things. But it can be if you see that if you're not on a diuretic or taking diuretic products like caffeine and alcohol. Having yellow urine can be a good sign that you're not getting enough hydration. But thirst is not the greatest, and The challenge is that most of us are not used to drinking straight water anymore. And so it's hard for people to drink enough water in a day. And it's a big issue as we get older.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The challenge is that if you have mitochondrial dysfunction, you have issues with fertility, you have brain fog, concentration issues, you have cardiac issues, liver detox issues, exercise-induced fatigue, all these things. And so working on mitochondrial function is so important. Insulin resistance actually